To talk more about what hospitals are doing. Jack, as we mentioned, is a public affairs and health communications expert, and he was at HHS and advised Secretary Alex Azar. Jack, can you hear us okay?
Yes.
Okay, great.
Technical difficulties are solved.
Okay, good. We can hear you too. That's great. Let's talk a little bit now about this vaccine that's being developed. Still a long ways out from actually being effective and working and being available to the public. But how big of a step is this in terms of the process of finding a cure for the novel coronavirus?
It's a big step. It's a big step. And, there are other companies right now that are moving forward as well in conjunction with HHS and NIH to do just that, to really get that vaccine. It's not easy because this is novel and yet progress is being made. I also want to mention antivirals because, as Dr. Fauci has said, those are the possibilities that can allow people to get treated if they indeed work. So yesterday, I believe, was the first time that a patient in Washington State was given one as part of the FDA's new authorities to allow compassionate use. And so there's some real possibilities from Remdesivir, from Gilead. There's some other companies that are working very hard right now in conjunction with Secretary Azar's team to find those antivirals. They're going to treat people.
No, that's important you mentioned that, too, because that's something the Trump administration has done well prior to this corona outbreak happening. That was making the process for getting these drugs approved easier through what you just talked about there. I also want to talk about what's going on at hospitals around the country right now. My sister works in an emergency room outside of Atlanta, and she's telling me about the preparations that they're making there. We hear about tents and mobile hospitals and all this gear that's needed. How is that going in terms of the national response now?
Yeah, it seems like that's going well. It's not being covered as much, so I'm glad you actually are asking about it because it's not sexy to cover all of the prep work that's being done right now in hospitals across the country, from the Cleveland Clinic putting up tents and Atrium Health in North and South Carolina to hospitals around here that are actually using a lot of the money that bipartisan members of Congress over the years and the Obama administration, the Bush and Trump administrations have been pushing forward to the states. In fact, the first package that went through had, I think, $1 billion meant for the states for this very purpose, for hospital preparations.
Yeah, and that's also an important point here. This happened and started after 9/11, trying to push some of these resources to local communities and state governments and municipalities, so they have the stuff that's needed when it's needed. And oftentimes we hear about problems in certain places, states or whatever, and that's a reflection on the states, not necessarily the federal government, right?
That is such a good point. I know that former HHS Secretary Mike Leavitt, who I used to work for, was on the air with you all. And, that was one of his big points when the first pandemic flu plan was presented, was it is absolutely essential if something like this were to happen, that states work very closely with the federal government. But, a lot of these decisions are actually state and local. So the decisions that are being made, and it was great to hear Governor Cuomo with his positive words about the administration, because now isn't the time for second guessing and backbiting. It's really the time for the administration and governors and both parties on Capitol Hill to come together. Today is a great day also on the positive front because of the new $1 trillion package that looks like there's growing consensus around in order to treat this.
Well, it seems like it's grown a little bit since I first came on the air about 30 minutes ago. We were talking about $850 billion. Now we're talking about $1 trillion, Jack. We know President Trump says they want to go big. They don't want to leave anything left to chance here, and that's what may be happening. Jack Kalavritinos, great to see you, sir. Thank you so much for your time. Look forward to our next conversation.
I really appreciate it. Thank you.